I'm going to be discussing the different underlying conditions that could contribute to your infertility. I'm focused on discussing and talking more about endometriosis, what that is, how it contributes to infertility, what are some common signs and symptoms, as well as what you should do if you suspect that you may have endometriosis. Endometriosis, in a nutshell, is a condition in which tissues that normally line the uterus begins to grow outside of the uterus while still operating and acting the same way it would or it should within the uterus. And what that basically means is that tissue, that rogue tissue that's supposed to line the uterus, is going through the same monthly cycle as the tissue that is within your uterus is going through. So as your body is thickening the lining of the uterus and is preparing for fertilization, is preparing for pregnancy, so is that other endometrial tissue that is outside of the uterus. It's doing the same exact thing. Now, when you don't become pregnant and you do not have a child, that's when your uterus is going to shed that unnecessary tissue, and that's when you go through your monthly cycle. So the tissue that is outside of the uterus is doing the exact same thing as well. So that's what causes a lot of the pain and inflammation and discomfort and the main issue with endometriosis. Endometriosis in and of itself does not cause infertility, but there are factors or conditions that happen when you have endometriosis that can contribute to infertility being an issue. One of the first things that can lead to or contribute to infertility being a problem if you have endometriosis is the fact that endometriosis causes a lot of inflammation to present itself within the body. And with that inflammation, the body is going to respond and it's going to release that inflammatory hormone known as cytokine, or cytokines are going to be released into your body. So with that happening, this is going to impair your body's ability to properly enter into the fertilization process or properly allow for a sperm to fertilize the egg the way that it should, and to lead to you going forward with a full-term pregnancy. Second way that endometriosis contributes to infertility is through scars and adhesions. So when these scars and adhesions develop on these reproductive organs, it's basically going to impair your reproductive system's ability to proper and function the way that it should. So this can lead to fallopian tubes becoming blocked. This can also cause issues with the ovaries becoming blocked and inhibited, and that is again going to lead to fertilization not occurring and issues with fertilization happening the way that it should. The third and final way that endometriosis contributes to infertility is going to be with, again, scars and adhesions that are, again, preventing the ovaries from properly performing and doing what they need to do. And this can actually contribute to the ovaries not producing eggs, or even worse, the ovary is producing eggs, but they're not able to release those eggs properly because they are blocked. And again, that's interfering with the process of fertilization and preventing that from occurring. Common signs and symptoms associated with endometriosis is going to be having a heavier than normal menstrual flow, experiencing prolonged periods that last longer than 7 days, feeling or having very painful periods in which there's no over-the-counter medicine, no Tylenol, no Aleve, no Advil that will give you relief from your symptoms, experiencing low back pain, lower pelvic pain, abdominal pain, and discomfort. Also having some bowel and urinary issues in the form of diarrhea, constipation, painful urination, having an increased urge or need to urinate or use a restroom, also having gas, bloating, and just abdominal discomfort. Chronic fatigue is also another common sign and symptom, as well as feeling some pain and discomfort in your lower extremities, especially your upper thigh. If you're experiencing those signs and symptoms, if this is something that you have been struggling with for a long time, and it's all of that I just listed, those signs and symptoms that I just mentioned, they sound exactly like what you have been going through, I highly encourage you to schedule an appointment with your doctor or your physician, so that way you can take all of this information and give it to them and try to find out if endometriosis could be causing or contributing to your infertility issues. Now, there are some steps that I am going to recommend that you take to help you get a proper diagnosis. Endometriosis is one of those things that's commonly misdiagnosed, and a lot of the times, a lot of doctors, they kind of brush it off. Women are seen as being overdramatic when we start talking about issues with our reproductive health, especially when it comes to our periods and things of that nature. So try these steps just to make sure that when you're visiting with your physician or your doctor, that it can help to expedite getting a proper diagnosis, getting that ball rolling, and getting solutions for your problem. The first thing that you're going to want to do is make sure that you have a symptom journal or a symptom log, and that's basically having like a notebook or a journal where you track all of your symptoms, you write everything down, you track your periods, you're tracking when you're experiencing these things, the date, the time, the severity, all of that information, you track it, you write it down in your journal, so that way you can take it with you when you go to your doctor visit. The second thing you're going to want to make sure that you do is you are going to want to investigate your health history, your family history. So if your mother had endometriosis, or she had fibroids, or what have you, did your sister, just digging back through your family history and looking at your health history, looking at what's been going on with your periods for the past year, the past 2 years, the past 3 years, what has been going on in your life and with your body when it comes to your reproductive health. Just sitting and taking the time to sit down and write all of that out and to make a note of all of these things, so that again you can compile all of this information along with your symptom log or your symptom tracker. You can take that to your physician. You can paint a full picture of what has been going on with your body, not just now, today, but for an extended period of time, as well as giving him some background history, what's going on with your family history, what's been going on in your personal health history. So again, you're painting this full broad spectrum picture of what has been happening, and it's kind of like you're giving them a timeline of events and what's been going on. Also making sure that you are very forthcoming and you're very transparent when it comes to just things that's been happening within your body, that you're not feeling awkward or ashamed, but you're just putting it all out there, being transparent when it comes to your sexual history, being transparent when it comes to things that's happening with your body when you're on your period, what's happening when you're not, just all of those things, being very forthcoming and transparent, even though that can be quite awkward sometimes when you're at the doctor, but just being really honest and really real is going to help again build and paint that picture, and it's going to give your doctor a clear indication of what's been going on, and also let them know that this is something that is very serious to you and that you've been having a problem with for quite some time. Now, if you have done all of those steps and your doctor for whatever reason is just flippant, they're not receptive, they're not really working, or you just don't get the feeling that they're making this a priority or that they're even worried about running any tests, and you have done your due diligence, you've done all of this, you've asked the questions, you've been super transparent, then I would suggest that it's time for you to get a second opinion. It's time for you to seek working with another doctor, perhaps looking for a doctor that specializes in reproductive health and fertility, or looking for a doctor who specializes in endometriosis if that's been something that has happened in your family history. If you've had a sibling with endometriosis, or your mother had endometriosis, then you definitely want to perhaps look into finding a doctor that specializes in endometriosis so that you can get the proper diagnosis and the proper solutions and answers to the questions that you're having, and not just get brushed off. That's all for today's video. I hope that you found this insightful and helpful, and that if you are experiencing any of these signs and symptoms, that this gives you the courage and the understanding that you can actually get those symptoms, track them, go to your doctor, present this body of evidence to them in a manner of speaking, so that you can get some solutions and you can get some answers as to what is going on with your body. If you found this video helpful, go ahead and hit that thumbs up button, and make sure that you subscribe and ring the notification bell, so that way you can continue to watch the other videos that I'm going to be creating for this infertility series, and you can continue to learn more about what are some different conditions that could be contributing to your infertility in your life. And as always, make sure that you are redefining your health and that you're doing everything that you can to stay forever young. Bye.